Welcome everybody to Green Living Gurus, and I am Therese Fortin Barnes, and I am an environmental toxins health coach and the head guru at the Green Living Gurus. And I'm very thankful that you are joining us today on this broadcast and to hear about thyroid health. There's a lot of information out there about the thyroid. And today we are talking to Maria McKendry. Welcome, Maria.
Hi, thanks for having me.
You are very welcome. I'm so happy that we connected because thyroid health, I don't know a lot about it, but I've studied, but I love talking to people that really have a specialty. So you are a holistic nutrition response testing practitioner,
Yes.
which we will get into. And she works for Synergy Nutrition and Wellness out of the Western New York region. Maria's passion for health and wellness started as a physical therapist. She graduated from Damon College in Western New York with a BS in physical therapy in 1996. As a licensed PT for 25 years, she has experience in outpatient orthopedic therapy, cardiac rehabilitation, home care, and long-term rehabilitation. Maria believes that our bodies were designed to thrive and heal. Amen, right?
Yes.
This belief challenges her to determine the underlying causes of ill health and implement personalized nutritional programs in order to achieve and maintain optimal health in a safe, natural, and non-invasive way. She enjoys creating a positive impact on her community by helping others become healthier versions of themselves. When she is not working, she is busy being a wife and a mom to her 3 children and her dog. And she has many interests and hobbies that mostly involve water, sunshine, and nature. She and I have a lot in common. I just don't have 3 children. So welcome today. Joining me here, Maria. I love what you do. I am so excited to talk to you about your practice, but let's start at the beginning. Let's back it up because let's talk about thyroid dysfunction. So many people go to the doctor, they give them medication, and they still have a thyroid dysfunction. It's just the medication is putting a Band-Aid on it. That's how I kind of view it. Instead of getting to the root cause of what is causing that dysfunction in your thyroid. And I know you are so good at talking about this, but what are the symptoms of thyroid dysfunction if somebody wouldn't even know?
Sure. So let's start off by just stating that an estimated 20 million Americans have a thyroid dysfunction, and 60% of them are not even aware of the fact that they have that. So 1 in 5 women will have a thyroid dysfunction in their lifetime, and 1 in 10 men. So that's a huge, huge number, right?
Yeah, that is.
The symptoms are mental slowing, okay? So brain fog, memory loss, depression, anxiety, dementia, all ages, weight gain or an unexplained weight loss, constipation, and dry skin, itchy skin, a hoarse voice, intolerance to cold. So we get that a lot in Buffalo, right? Irregular menstruation, infertility is a big one with thyroid. Muscle, joint stiffness and pain. Fatigue is huge. Fatigue, hair falling out, brittle nails, low sex drive. We could go on in here, but those are the main things.
Main symptoms. So then you realize somebody's got a thyroid dysfunction and now you're getting ready to treat them. But what's there's a conventional approach and there's a holistic approach. So there's medication versus removing the toxicities and going on a whole food nutrition, maybe supplements. So let's talk about that.
Right. So I'll just state I'm not a doctor, so I don't treat disease, I don't diagnose. So what I do is I get to the underlying root cause of what is causing this issue. And we're looking for toxicities, especially with thyroid metals and chemicals. We're looking for underlying immune challenges. Is there a parasite? A lot of thyroid dysfunction is caused by the parasite, real tiny microscopic parasite that can start in the gut through our food and water, especially, and attack the thyroid. So we're looking for parasites, we're looking for bacteria, overgrowth of viruses, fungus, all of these things. And even different foods can affect the thyroid, especially bread. So bread is one of the number one things that is going to affect your thyroid because there's something in it called potassium bromide. And potassium bromide is a chemical that will go right for your thyroid because it's very close to the thyroid hormone in nature. So things like potassium bromide found in breads, especially white breads, as well as chlorine and fluoride, all will go right for the thyroid because they're all in the same column on the periodic table as iodine, which the thyroid needs. But if your thyroid is dysfunctioning, it will substitute for the iodine and cause a problem. So we're looking for all of these underlying causes when we're looking at the thyroid, and then we're helping people straighten out their diets, essentially, because processed foods and sugar are disrupting the gut, and then that will affect the thyroid as well. So we're teaching people how to eat clean diets and what to eat, what not to eat. We can get into that a little bit later too, if you want. So that's what I do. And I do that all through nutrition response testing and providing whole food supplements.
Someone once told me, I hear this often, that the gut is where all illnesses begin, but the thyroid really rules the body.
The thyroid is the most important organ in your body. It really is. And you're right, all disease starts in the gut. It really does. So unfortunately, our diets, standard American diets, were created out of a need to feed people and prevent people from starving. So we made all of this cheap processed food to prevent people from starving. However, what we've created is an incredibly sick society.
Mm-hmm. Interesting. So the remedies, let's talk about that. What you recommend in remedies. And I know we can talk about foods too, if you want to throw that in there as well, because that's so important.
Yeah, so the remedies are, number one, adapt a whole food diet, okay? And we can help you with that at Synergy Nutrition and Wellness. We have every patient keep a food log, and we review that in detail with people to make the necessary changes. And not to sound cocky, but a lot of people think they're eating correctly, but they're really just not. There's a lot of slick advertising out there, gluten-free, etc. And people think they're doing the right thing, but they're just not. So we're here to teach them how to read labels, etc., and eat whole foods. Number one is, adapt a whole food diet. Number two would be get rid of the toxic load, I would say, and help people reduce their toxic load. So you talk a lot about this. You're really helping people in a huge way. So thank you for that. As to how to drink, water, clean water is huge. So our water is full of toxins. And so one thing that we'll tell people right away is you have to drink clean water. So getting a filter or filtration system, either on your drinking water or everything in your home, is so, so important. The other thing that we look for are immune challenges like parasites, overgrowth of bacteria, viruses, fungus, mold. All of these things can affect the thyroid, and we try to, handle that via diet, but sometimes you really do have to take supplements to get those toxicities out of your body. And we have a really neat company that we work with, Cellcore Bioscience, which has developed these supplements to help rid your body of these immune challenges and toxicities via something called carbon technology, which is really a new and super exciting thing. So a lot of companies are trying to copy what they're doing with carbon technology, but they really are the front runners in this industry, and they have scientists and doctors on staff who formulate all of their products. It's not something we recommend doing on your own. So getting a carbon technology binder and just starting to take that on your own is really not a good idea. There's a certain way you have to handle these toxicities so that you're not overloading your liver and gallbladder and your digestive tract. So we really help people with that. And just follow a certain protocol, but we're there also to tweak that protocol because not everybody's body is the same. So that's a remedy, is to supplement with the carbon technology, drink filtered water, eat whole foods, eat 5 to 6 servings of veggies a day, eat good fats. That's really important too. Avoid white flour and processed grains. And replace your household cleaners and personal care products because they're loaded with toxins. All the cosmetics you use, everything you're using to clean your home. You know all about that, and you teach all of your people that. So thank you for that. But we try to teach our patients all of that too. And a big thing that a lot of women do is they use perfume. And where do they spray that perfume? Right on their neck near the thyroid. So just to back up a little bit, the thyroid is that butterfly gland right on your throat here. Yep. And think about everything that you're, putting lotions and concealer and perfume and whatever else. And your, people who are on their cell phones, where do they hold that? Right in front of their thyroid. So the EMFs have a lot to do with thyroid health too. So there's just a lot of things, and the thyroid is just what we call the canary in the coal mine. It's very sensitive. I don't know if you've ever heard that term, but
I haven't. I like that though.
Yeah, so what it means is in the coal mining days, they used to send a canary in the mine first, and if it came back out, it was safe to go in. If it didn't, it probably died from the toxins, unfortunately. So we call the thyroid the canary in the coal mine because it is so sensitive.
Interesting. I recently just had my thyroid tested because on one of these videos that I did on my social media, someone sent me a message and said, your thyroid looks enlarged. Of course, I got panicky. So I went and had all doctor and all tests. He goes, nope, you're fine. But you have it looks on camera if it comes the wrong way. But I had them all tested, which
Good.
all my numbers were fine.
So that's something we could talk about too, because sometimes their idea of what's fine and our idea in holistic functional care, natural health is completely different. So they're looking at just TSH, okay, which is a number that's showing you actually what the pituitary is doing. But to look at what your thyroid is doing, you should really get a full panel so that you're looking at all of the numbers, the important numbers, TSH, free T4, T3, reverse T3, and the antibodies. So we really need that whole picture. Also, their normal range of TSH is 0.4 to 4.0. And what we find in functional nutrition is that people feel a lot better and have a lot less symptoms when they're closer to 1 or less. So anywhere from 0 to 1, provided that their symptoms are not going hyperthyroid. In other words, they're not all amped up and getting heart palpitations, etc., is where we want people 0 to 1. So our numbers are much, much different. And a lot of people are told their thyroid is fine when it's really not. So if they're still, having the symptoms of fatigue, hair falling out, the big, wide lump on their neck, et cetera, all the things I mentioned before too, then we're going to handle it nutritionally and with supplements. So unfortunately, that number, people are being told they're fine, but they may not necessarily be fine.
And now looking for all the other measurements that you just mentioned. And actually, I did know all that. So
Right.
I'm so glad you brought that up, because I would never be able to say that, because I'm not that knowledgeable in this area. And it's so nice to hear somebody that can really talk about it, because the thyroid is so important, as we already mentioned.
Mhm.
So what about foods to avoid? Are there certain foods you should keep out of your diet?
Yeah. So again, all the breads, especially white bread, sprouted grains, we allow Ezekiel type of breads into people's diets, but the white grains are going to have potassium bromide. So again, that chemical, and glyphosate.
I'm so glad you're
Is
bringing this up. That's what I was just thinking. Go
Oh
ahead.
my gosh, glyphosate is so bad for your gut and everything, especially the thyroid too. So we need to get that out of the diet. We actually have the carbon technology to bind glyphosate now, which is so exciting. So we're using that on a lot of our patients, not only with thyroid disorders, but everything. Um, and so back to foods, I get really excited about our binders, but
That's great.
um, yeah, sugar. I mean, sugar is so inflammatory to the gut, and all of your refined carbohydrates. Unfortunately, most alcohol too is going to disrupt the lining of your gut. So we ask people to limit that, drink a dry wine if you have to have something or whatever, but try to avoid it if you can. Minimize stress. Stress has a lot to do with your thyroid too. So try to do whatever you can, yoga or meditation, exercise. And, a lot of busy moms and people my age in their 40s struggle with their thyroid. And I tell them, just take whatever time you can, even if it's just 5 minutes a day for yourself, because women are just so always taking care of everybody else and just never getting any downtime. So stress is huge too. And spend some time in the sun every day. Vitamin D levels have a lot to do with your thyroid health as well. Um, Selenium is a huge nutrient that you need for your thyroid. So to convert T4 to T3 in the liver, you need adequate selenium and zinc. And selenium, you can actually find in Brazil nuts. So Brazil nuts, are a good source of selenium for your thyroid. They do have omega-6 fatty acids in them. So we tell people just limit it to like 2 Brazil nuts a day for your selenium. And that's a real easy way to get your selenium. We also have supplements with iodine, selenium, and zinc in it. So one supplement for all three, which is pretty cool. And iodine is really hard to get in your diet, but it's so essential for thyroid health. So we recommend, if you can, eat eggs and seaweed. Those are good sources of iodine. Of course, your fresh vegetables and fruits. Selenium's also in mushrooms, shrimp, halibut, salmon, scallop, chicken, again, eggs, and lamb and turkey too. So you can get some selenium in those things. Coconut oil, that's a good source of fat. It's antifungal, antibacterial, so that's good for the thyroid. We actually carry something called black cumin seed oil that we'll have people take orally, and we have them rub it over their thyroid too, because it goes right through the skin to the thyroid and helps to clean it. So in addition to sometimes having to supplement with a thyroid supplement, we use a bovine thyroid supplement that we source from a doctor who practiced out of Texas. Unfortunately, he passed away recently, but we still are able to get our bovine thyroid supplement. It comes from grass-fed cows in New Zealand, and it works really well to help heal the thyroids, in addition to taking iodine, selenium, and zinc, and cleaning up the diet and the environmental toxins.
A lot of great information here. And I want to touch a little bit on the glyphosate, because people might not know what glyphosate is. It's in Roundup. So it's an herbicide, right? Herbicide, pesticide, one of those two, but it is the ingredient that Monsanto has that goes into Roundup, that there's over 100,000 lawsuits against Monsanto regarding glyphosate. And the big one was just out in California recently. And I just interviewed the author of the book that followed that story, and she also broke the story.
I saw that. Awesome.
Yeah, Carrie Gillum, she's fabulous. Now she's on to another chemical that they're putting in other pesticides right now. But the glyphosate, unless you eat organic food, you are eating glyphosate. So we pretty much all have glyphosate in us. We just want to reduce the amount of glyphosate in us. So glyphosate is in our water. Glyphosate is in produce. Glyphosate's in bread. Anything that has corn, glyphosate, because it is so widely used, and it is not being banned yet, which is absolutely insane with the amount of cancer that is out there.
Cancer,
Alzheimer's. We're
Alzheimer's.
passionate about this because it is something that can be avoided.
Right.
And now, it affects every part of your body. And then you take glyphosate and you mix it with all the other chemicals that you're putting in your body. We don't know what that's doing to us. So thank you for mentioning that. I think it's a huge factor. It's not allowed in a lot of other countries, actually.
No.
And so
well, I learned something interesting recently about glyphosate, is that it's, even if a farm claims that it's organic, so let's say you had a farm and this year you wanted to make it an organic farm, you could get approved to do that. However, the soil, the half-life of glyphosate for, I think sand soil is 21 years. So it's still in the soil for that long. And then for clay soil, it's 30 years. So yeah, even though you're buying organic produce, there still may be glyphosate in that soil that's entering your body and disrupting your gut, disrupting your brain, all of your organs. And now they're even finding that there's so many children getting ACL tears, and they're linking that to glyphosate because it's attacking the ligaments, which is why we're seeing so many young athletes with these ACL tears. I mean, think about it. When you and I were younger, there was maybe one or two people we knew who had that, right, from an athletic injury. But now it's getting into these kids' systems and ruining their joints at a very young age. So the average ACL tear is now, this is my PT background, is 5 to 13 years of age, which is crazy.
Wow.
And they're even linking glyphosate to one of the potential causes of autism. So yeah, it's a huge problem.
Huge. And one other thing that you mentioned about alcohol and wine and beer, I am adamant about every bottle of wine that comes into this house, or even
chemicals,
like beer, we do organic beer. Michelob Ultra organic beer. That's what
there you go.
It's great. And then of course organic wine, and it's because wine is so
sprayed.
And you can't get rid of that. I mean, it goes into the grapes that are being picked. So
yeah, and you wonder why you feel so awful the next day.
so true. I know that so different when I have a couple glasses of non-organic wine and organic wine.
Same.
Total difference in feeling.
Same. So there's actually stores here now in Buffalo. I love it. They're actually setting up separate, organic wine areas in their stores, or just labeling what is organic, which is so cool.
It is great. They need, there's one wine store that I go to on Rhode Island in Buffalo called Paradise Wine. I actually did an interview with her. She's on our YouTube channel and blog and everything, or not blog, podcast called Paradise Wine. So she just focuses all on organic, all on biodynamic wine, sustainable wine, which is great. All the other stores, everywhere you live, wherever you are, ask the stores because they are carrying organic wine. It might not be labeled organic or biodynamic, which is even one step above organic, but ask them because there's so many great organic bottles of wine now.
There really are.
There are, and you can
once you find a couple, that's all you need. And I heard, I don't know how true this is, but most wine from Europe, like Italy, etc., they don't even really, you don't need to worry about it too much. I don't know how true that is, but
it's close. You still have to be careful. Some do spray, some went to the spraying years ago, some are turning back. It's not over in Europe so much as it is in the United States. And
right.
It's, so you just
so now suddenly we started talking about wine.
Always goes back to wine.
Right.
Well, it is a food and what we got, for happy hour food. Anyway, so let's get back to the thyroid, because I know wine, you shouldn't be drinking alcohol or
right. It'll affect your liver enzymes, which affects your thyroid, right?
Yeah.
So
if you're gonna drink it, drink organic. Do the right
and
thing.
dry wine, not sugary.
No sugar. That's right. And we talked a little bit about sugar because sugar is in so many different. My husband came home with yogurt the other day. I said, "Did you look at the label? There's only one yogurt I really buy, and it has nothing but yogurt in it." And he said, "Oh, it said low fat, no sugar or something." I said, "Yeah, but instead of sugar, they put something else that is sugar."
Yeah, and low fat usually means they took out the fat and they added sugar.
Yeah,
and
they
chemicals.
have to have the sugar because otherwise it doesn't taste good if it doesn't have the fat.
Right.
That is good. And that's marketing. And I know you brought that up before. And for anybody listening, it's not you. So you don't have to be mad.
No, even we get fooled.
We get fooled. It's marketing. It's what you see on TV. It's what you see on the packaging. So it's all about just paying attention and reading the label. The label is so important to read.
So important.
Right? It'll tell you. And
because whatever it says on the front, organic, whatever, natural, etc. That doesn't matter. You have to read the label.
Yeah,
and they're disguising sugar as so many different things now too, right? So
dozens and dozens of different words. It's in ketchup, mayonnaise, yogurt, you name it. They put it in so many things to make it taste better.
I know.
So it's like salt, they shove the sugar and salt in there. So let's get back to nutrition response testing. We talked about what people can do, but let's talk about nutrition response testing. Sure. I think this is so interesting, your practice.
So nutrition response testing, so I work out of Synergy Nutrition and Wellness. I'm at the Clarence and Williamsville location here in Buffalo, New York. I also do telehealth visits with people. It is a nutrition response testing is a duplicatable system. So there's practitioners like me all over the country. I work with a group of 5 other practitioners. The owner is Jimmy Scaringi, and we have Tracy, who's a nurse practitioner, and Heather's a nurse practitioner on staff as practitioners doing this with me, and Andy and Tara is a physician assistant, and she's Jimmy's wife, so she's working with us as a nutrition response tester too. So we're all highly educated people who have decided that this is the way we want to go with our health career and treat people naturally via nutrition response testing, which is a duplicatable system that allows us to assess how well your body is functioning and what nutritional deficiencies you have. And so we do it through muscle testing. And we can assess your what we call the autonomic nervous system and the function of every organ and gland in your body. So every organ and gland in your body has a reflex, kind of like when you go to the doctor and they tap on your knee, your leg goes up. So every organ and gland in your body has a reflex. And we're checking those reflex to see what energy or lack of energy is there and how it's affecting the function of your body. So through this testing, we can also assess barriers to healing like food sensitivities, immune challenges, metal and chemical toxicities. And then we help you determine the correct food supplements and how to fix your diet, and just give your body the best possible chance to get well and stay well through our testing. And we do a really good job of it, not to toot our own horn, but we usually get 90% or better results with what we do, provided that you follow through on our recommendations and you give it time. So that is what we do.
I love it. So and you can do that through telehealth too, right? You don't have
And we do. We can use the information that you're providing us. We take a really extensive history. So your first visit with us is usually an hour of paperwork and then another 45 minutes with me to do the testing and talk about what is going on with your body, get a thorough history. So via telehealth, we just send you all that paperwork, you send it back to us, and then I'll talk to you via Zoom or FaceTime, whatever, about your issues. And then we can actually do that testing through an intertester that we have in my office, my assistant, with you right there via telehealth. And we can help you that way. And it's also very accurate to do it that way. We're getting great results. I just had a patient from Puerto Rico the other day. So we're treating people all over the country.
Love it. Country. Yes. And so is there anything we forgot to mention regarding the thyroid nutrition response testing? I know that I will post where to get in touch with you, the website 716 Synergy. They have an Instagram page, they have Facebook. So you can reach out to Maria and she will, right? They can reach out to you directly.
Yes, you can reach out to us via a phone call, 716-713-2499. Again, you mentioned the website. Thank you for that. And I did want to offer to anyone who is interested in nutrition response testing with me, if you're watching this, just mention when you call or email us that you saw this, and I will actually give you a free consultation worth $150. So yeah, we want to help as many people as we can naturally without drugs or surgery. So just getting the word out about what we do. You having me on this show is, or whatever we want to call this.
So it's a podcast, it's a multi.
Okay, I wasn't sure where it was going. I'm fine with wherever you want to put it. But yeah, thank you so much.
On the podcast, it's everywhere. So I want as many people to see it as possible. That's my goal with doing all of these interviews.
I love that. I love that.
So I have a question for you that just
sure.
Because I know people that are on Synthrex and
Thyroid.
Thyroid. So is that something that they eventually get off of? Are your clients eventually off of those?
My clients, that is, so this is a tricky subject because again, we don't diagnose or treat, right? But most people who come in on Thyroid are still having symptoms of a thyroid disorder, right? And so the Thyroid is not necessarily healing the thyroid, it's just getting their TSH at a good level. But unfortunately, most patients still don't feel well on it. So if the patient is looking for help getting off of that medication, we can't do that. But what we can do is work with that patient, and they must work with their doctor to get off the medication if that's what they want to do. So we'll work together. And most doctors are pretty good about that and what we do. And they understand, exactly what we do by offering the bovine thyroid supplement, selenium, iodine, zinc, cleaning up the diet. And it's something that the patient has to do gradually. You can't just go off your medication one day. So it's something that the doctor has to just keep decreasing the dose, and then slowly over time, we can get people off Synthroid who have been on it sometimes for 30 plus years. It's unbelievable. So I've had patients as young as 10 or 13 years of age. They were put on Synthroid and just not feeling well at all. And so many health issues. So that is something we can help you do for sure. And we get great results with our supplements and changing people's diet and getting the toxicities out. That is really, honestly, that's, people can present with parasites and viruses and bacteria and horrible diets, etc. But the underlying cause of most thyroid disorders is the environmental toxicities.
Interesting. And I learned something today, even though I probably knew it, but I didn't think about it. Perfume. I mean, I can't stand perfume. Anybody that wears perfume shouldn't be wearing perfume, honestly.
Yeah, I tell all my patients, do not come in with that. Don't wear that to my office. I'm so sensitive to it, but it's so bad for you too, because of all the chemicals, especially fragrance, right? That word alone. If you see that on any of your products, you need to ditch it, because they can put up to 3,000 toxic chemicals under the word fragrance that they don't even have to list on your product.
Right. And they're all chemicals. I mean, perfume. So perfume, the reason why they don't have to list that is because of the perfume industry from many, many decades ago, when they came out with their recipes for their perfume and they called them trade secrets. And so the government said, oh, well, they told the government, we don't want to list the ingredients because we don't want anybody to know our trade secret. So there is a law. If you put the word fragrance on any product, you do not have to tell them what is in that fragrance. And so it has been such a loophole in the United States.
Yeah. And that goes for everything, like all these bath bombs that people are bathing their children in, and all of your cosmetics, your candles, your air fresheners, all of that is so toxic. Yep, everything. And so as you know, some women are like, well, I have to wear some type of fragrance. They're just completely addicted to it. So at that point, I'll just say, how about an essential oil, like an orange oil or a lemon oil or lavender oil, something like that, that's all natural. I mean, there's a few perfumes out there. I think Michelle Pfeiffer carries an all natural perfume, but for the most part, they all have a lot of chemicals and fragrance in it.
They do. And it's something to just be aware of. So again, reading your labels, reading what those ingredients are, whether it says fragrance or perfume, they can hide so many toxic cancer causing chemicals on that label. So this is why we do what we do, Maria, because we want people to know
get the word out.
Secrets out there, right? That we know. The companies that produce these products don't want you to know.
Right.
That's why. And then what you do, thank you for everything you're doing, because one by one, we're helping people realize all of these issues that are happening to our bodies and to our organs. So
we're fighting the good fight. We're
fighting the good fight, one at a time.
That's right.
We're binding together, and we're charging after these companies that are producing these chemicals that are just wreaking havoc on our bodies and kids. And it's gotten worse over the years, and children and girls trying to get pregnant, and we didn't even touch it on endocrine disruptors, which are a whole list of other, similar. I mean, we sort of touched on it. So many chemicals just mess with your endocrine cycle. And now they're saying sperm count is way down because so many of these chemicals, and men are affected now.
Low testosterone.
And women are going to start have a hard time having children, because not only their endocrine system is messed up because of these chemicals, but the men's sperm value is getting to be horrible. It's a huge issue.
Right.
now.
So
They're
when we
calling
have
it-
infertility cases at Synergy, we work with both the woman and the man to
Great.
clean up both of their systems and
Yeah.
help them with whatever they test for and need. So that's
Yeah.
super important to get the man in too.
There's a great movie called Overload. Susie Eastman produced it. And it was all about the toxic chemicals that we put on and in our body every day. And she actually went through a test and had her body tested for all the chemicals. I think she went to Cleveland Clinic. I can't remember. I interviewed her too. I love her. And then she actually lost 30 pounds because of all the things she had to change in her diet and products, and how many products have chemicals.
That's a good point right there, is we don't really focus on weight loss at Synergy. It just happens.
And there's so many chemicals that are in the obesogen category. So there's chemicals that actually contribute to weight loss that are in a lot of these products that are called obesogen. So we could probably sit here and talk for hours, Maria.
Yeah. We'll have to do another one of these.
Yeah, absolutely. We can focus on just the endocrine cycle. We can focus on obesogen. So, well, we'll talk soon. There's that movie, just so you know, it's called Overload. It was on Netflix. It's or Amazon Prime. I don't know where it is now, but you can Google it. It's fabulous. Susie, her name's spelled Soozie. Watch the trailer. I was so fascinated. She put so much time and effort into this movie, and now she's trying to launch it somewhere else, but it really
Awesome.
gives you a good idea about what happens to our bodies when you put all these chemicals on them and in them. And she got pregnant right after she went through all this because she was having trouble getting pregnant. So
Awesome.
well, thank you so much for joining me here today.
Thank
and
you.
I look forward, yeah, absolutely love what you're doing. Look forward to meeting in person. I know we have to schedule that as well.
I know. How have we never met? We have so many common people in our
I
lives.
know. Well,
We will.
Definitely make that happen soon now that the warm weather's coming around. So
Sounds good, Therese. Thanks for having me.
You are welcome. Thank you